Okay, I want to thank you for tuning into the Change After 40 podcast. I am your host, Anisha Graham, and today we have a special guest with us, Dr. Kennedy. Thank you for joining us today. And we're going to be talking about health and wellness, and I love your TikTok videos, your Instagram, how you're getting information out for people, women of color, to know about their bodies, a lot of things that I really didn't know or I heard of, but didn't really understand. So I really appreciate you using your platform to educate people. And I'm just so awesome that you're on my podcast. So I'm going to let you introduce yourself and give a little bit about your background.
Sure. I go by Dr. Katina, so you don't have to say Dr. Kennedy. It's
okay.
Katina.
Dr. Katina.
I'm a family nurse. I'm a dual certified family and psychiatric nurse practitioner. So I do primary care, gynecology, urgent care, and mental health in my private practice. I have my own practice as well, where I work independently as a nurse practitioner. I've been practicing since 2007. I'm also an author. I have a book called Let's Talk Sex and STDs, a guide to prepare parents for the talk, and also the student edition. So it's just for teens and teens. I'm also an entrepreneur. I have a lube that's out. It's all personal lube. It's called Sex Stevia. It can be used via anal or vaginal sex. We'll probably get more into that later.
Yes.
And then I'm also a television and radio health expert. So you may have seen me on various national television shows. You may have heard me on the radio. And I love what I do. I'm also a speaker as well. So I speak at various health conferences. So I'll wear many hats, but it's all about promoting health awareness, health education to the community, nationally and locally. And thank you for having me. I'm glad to be here.
Oh, no, thank you. Okay, so let's get into it about this. That book I want to order. The products that you're promoting looks a little interesting. So let's talk about that, because, a lot of people don't really like to talk about the sex part of things. And it's something that married people do. People that's not married, people just do general. So, it's things that we really need to talk about. And I think for me, as I turned 40, my body changed. Like, things, and I really didn't understand what was going on, and, the hormone levels and this and that. So
it's and like you say, it's part of life, and it can be a cultural thing. Maybe a lot of, growing up, I've heard like a lot of African Americans, Caribbean families, sex isn't talked about. It's looked at, oh my gosh, you better not do it. We don't educate each other about it. All you hear is, don't you do it. Don't you get pregnant. But we don't engage in that conversation. So that's why I created that book. And then, a lot of people come to see me as their nurse practitioner, their healthcare provider, because they feel like they can actually talk to me like I'm their homegirl, or if they're a little younger, or their sister. And I provide information in lay terms, because sex has been around forever.
Yeah.
We create, procreate. That's how we continue human evolution. So it's important, and it's a part of life. And as you mentioned, after 40, those changes do occur.
Yes.
Seems like after I hit 40, I started aching and waking all stiff. So, but not just that, but a lot of women come in, and even before 40, it occurs. It doesn't have to happen after 40, but after 40, I do see where there's a little bit more of the stressors in life that affect us, not only mentally, but physically as well. So we have the kids we have to attain to. We have to, make sure our significant other is taken care of, our businesses, because we're, entrepreneurs. So we have a lot of different stressors that can affect us mentally. And then here comes the sex part, right? It's I don't have the libido. People come in, they say, I have no interest. I'm not thinking about that. And then when, your partner says, well, you never come on to me. Men like to be turned on, y'all ladies. So don't you forget that. All right. Don't always wait on them to come and, start the initiate. You have to initiate as well, because that's very important. But, with the decreased lubrication that can occur because you're not mentally there, so all of that works in together. When you're stressed out,
yes,
able to get as wet. I speak candid. So for those who, follow me on social media, I speak in
I like it. I like it. So I have no problem with it. Because we're adults. It is what it is. But
and y'all know those late terms. So we won't get wet. If you are not, there mentally.
Yes.
Women come in, I do check their hormones because, of course, if their hormones are off, like their thyroid, the estrogen, progesterone, prolactin levels. So those are some. DHEA is a very important, that's the sex hormone. So I check that. And when that's low, that can cause the decreased libido and then ability to get lubricated as well. So, I check all of that, but most times, related to, unless you're going through menopause, and we'll talk about that, but unless you're going through menopause, it is mentally. So ladies, we have to make sure that, time management is key. The older you get, you are going to have to definitely plan,
Yeah.
So everybody says, let's make it spontaneous. Yes, you want to have those spontaneous moments, but you want to plan your intimate time as well, because you want to make sure that you get it in, right, Amisha?
Yes. And it's so like, you're a wife, your mom, you're like how I am, I'm an entrepreneur, business owner. So it's like, okay, like, do people really schedule in that time to okay, on this day, this is what me and my husband going to do? And it's just like, okay. So,
and that's important, because if you do have the busy lives, it's okay to schedule it in, because you got to make sure these men are taken care of. Because when the older you get, men, not to say that, and it's not all, but women, some women, majority of women actually, sex is not priority, but men,
we get too comfortable.
Yeah, you get comfortable, and men, that's their love language.
Yes.
That sexual intimacy, that penetration, that feel, that touch. So, you have to make sure you keep your partner satisfied, men or women, because we're dealing with homosexual couples as well.
Yes.
You have to make sure that you just stay engaged and stay focused. And even if that means pinning it in the calendar, you have to.
Yeah, you have to do what you have to do to keep, like you said, keep that spice going, that the love language going. And okay, so you mentioned something about thyroid. So I have a thyroid issue, and it really affected me on so many levels, and I didn't understand that the thyroid plays a big part of well-being, and until I really started researching and doing a lot of stuff on it. And with that hormone level type thing with the thyroid, that is really serious. And a lot of people that I talk to that's noticing that they have a thyroid issue now is saying the same thing. And it's just like, okay, what can we do? What is it, like exercises that we can, that you can do? Just, I guess, life changes that you need to do to help that area of, I know, go to the doctor,
So let's talk about that. So the first things first is knowing your health status, and that's something that I constantly promote: knowing your health status.
Yes.
I don't know. I always say the big three: BCB, your blood pressure, your cholesterol, and blood sugar. Those are foundational to your health. So you need to go get yourself checked to see your thyroid level, to see if you're anemic, because if you're anemic, low iron, that can cause lack of oxygen to your tissue. So you can feel tired. You'll actually have decreased lubrication to the vaginal area as well, to the penis area as well, for those men who, so because remember, it's oxygen that's, in the blood. So if the blood, you don't have enough blood, you're not going to get oxygen to your tissues.
Exactly.
You have to know and then when it comes to cholesterol, cholesterol is high, that can actually clog up the arteries, not only of your heart, but in your legs. And for men as well, the penis as well. So men who have erectile dysfunction, it can, it could be because of the arteries being clogged, because of high cholesterol. And then blood pressure. Blood pressure, that's big. A lot of people come into the office, they never check their blood pressure. That's why on social media, I have this thing called Blood Pressure Tuesdays, just to remind my followers to go check your blood pressure. Because if you have high blood pressure, well, we know that high blood pressure is a silent killer.
Yes.
Sometimes you never know you have it until you're having a stroke, or you're having numbness and tingling on one side, or if you are, feeling fatigue, you're feeling tired, you're getting blurred vision. So these are possibly some symptoms that some people have, but uncontrolled high blood pressure can over time damage the kidneys. That's how people end up on dialysis. It also enlarges the heart. So because the heart has to work extra hard. So knowing your health status, the big three, BCB, blood pressure, cholesterol, and blood sugar, is key. However, and speaking about that thyroid, that's a big one. The thyroid hormone is, you have the gland that's right here at the, we call it the anterior part of the neck here. And that's a thyroid gland that regulates our thyroid hormone. And our thyroid hormone is big to our body. That actually, it regulates our metabolism. So if you're having difficulty losing weight, if you're losing weight too fast, it could be a thyroid problem. You have different types of thyroid disorders called hypo, which is an underactive thyroid. When everything is slow, that's where you get the weight gain. That's where you get the hair loss. That's where you get the coldness. That's where you get the increased hunger. So that's hypothyroidism. And then we have hyperthyroidism, which is when everything is sped up. And that's when, you lose weight without trying. A lot of people say, oh, I have that. And I say, no, you don't. That'll burn out your heart, because it's basically your body is exercising constantly now.
Yeah.
And that's dangerous for the heart. I've known some patients over time to unfortunately go into hyperthyroidism crisis and have to be hospitalized.
Oh, wow.
So it can be very serious, but hyperthyroidism, that's when you have, and then with hypo and hyper, you can have the irregular periods as well. So, if before you start any weight loss program, I definitely recommend you know your health status, go get your blood work done, because you won't be able to lose weight unless your thyroid is actually working properly. Unfortunately, the only things that can help once you actually have the disorder is medication, because it's a hormone that your body makes. And I personally don't know of any natural supplements that you can take when you actually have the thyroid disorder. Now, I know there's supplements to help just keep your thyroid on track, but when you have the disorder, a lot of times you need that medication. And this can be genetic. Sometimes it runs in the family. Sometimes we just don't know the cause. Sometimes it's caused by nodules or cysts that are on the thyroid gland. So I recommend getting that thyroid ultrasound as well. But yeah, the thyroid is very serious. You brought up a really good point. And that's something that you definitely want to get checked.
And it's becoming very common in a lot of young people. And you made the video, I don't know if it was last week or whatever, how to, if the ladies or men, you notice your neck area getting a little swollen or a little bit, because you think, okay, I'm gaining weight. But actually it could be that your thyroid is actually in crisis. Like you said, you need to go to the doctor. And I would have never known that I had the issue if I noticed that I was dieting and I wasn't losing the weight. And I was like, what is really going on? Like, I'm spending all this money trying to lose weight. And my doctor said, let's run some tests. And she ran my tests. And that's how we found out. And then once she got me on the medication, I was losing the weight, and I lost the weight like really good at one point. But now I'm back at that point where it's just I'm not losing it. But, we're doing other things. So
Well, a lot of times too, when it comes to the thyroid gland and weight loss, as long as your thyroid levels are normal, then you have to implement, different strategies to maintain or to help you lose weight, such as, so this is a couple things. I hope you ladies and men are writing this down.
Yes.
Oh, number one, you have to get at least 6 hours of sleep. When my patients come in and they're on my weight management program, you have and the reason why is because when you don't get sleep, number one, the cortisol level, which is the stress hormone, it actually increases in the body. When there's too much cortisol level in the body, it causes fat deposits within the body. So it increases the fat cells. So it's important not only to get your sleep for losing weight, but for mental as well. If you're not getting enough sleep, you're going to be tired. You're going to of concentration, lack of focus, you're not going to have any energy. I have patients that come into the office, they say, oh, I'm always tired. I'm not feeling well. Well, how many hours of sleep are you getting? 4. Like, how do you expect to function off of that? There are 2 things in life that you need to do to refuel your body. Okay. You have to fuel your body to run right. And that's sleep, and that's food. And that's 3 things: hydration.
Yes.
You have to intake. You have people that go all day without eating or wait prolonged periods. It looked like I'm hitting on something there.
That you're talking to me, because I will wake up and I take my thyroid medication as soon as I get up, and go hours and hours, and before you know, it's like, oh wow, it's 3 o'clock and I haven't eaten all day.
Yeah. And that's, your body's not energized at that point, and your body goes into what they call protection mode. So what happens is your body starts to actually, store fat. So instead of burning the fat, it's storing the fat in your body for energy, because it's saying this person's not going to feed me till hours later. I don't know when this person's going to feed me. So it's versus burning the fat. So, with the weight loss, it's important to get your 6 hours of sleep, drink all water, stay away from whites, no white bread, no white rice, no white pasta. The reason why is because those starches do nothing for us. After you eat them, how do you feel, Amisha? After you eat some good old rice, how you feel?
Sluggish. I'm not a rice person unless on Sunday, my husband wants a hearty meal. But I don't like that sluggish feeling.
Yeah, it drains.
And then I noticed, sorry to cut you off, I noticed at one point I stopped eating meat. I felt totally good. And then, you go back to your bad habits or whatever.
Yeah. So, the whites have no nutritional value to So I tell folks, why are you eating it? So instead of eating the white rice, you can do like your brown rice. You can do your whole grain bread versus the white bread. You can do if you have to do, you can do your wheat pasta. That's fine. They have cauliflower rice out there now. There's many different, things that you can definitely do, but staying away from the whites, getting your sleep, not skipping your meals. You're supposed to eat today.
So I hope you guys are listening to Dr. Katina. She's telling you some good information, but she's telling you that you have to consult with your doctor, or if you're in the area and you're looking for a doctor, she's available to be, I know, but to be your doctor. But she's giving you some good information. Your body tells you when it's time to see the doctor.
Yes. And then it's all about preventative care as well. So you don't just want to go in when you're not feeling well. You need to go for your yearly physical. That goes at what I said before, knowing your health status. Just like you know what's going in and out of your bank account, right? Every transaction. You need to know the same thing about your body, because your body is your temple. That's you. And if it's right, you can't carry out what you're trying to do. You can't take care of your peoples. You can't take care of your business, So
exactly.
got to take care of yourself, ladies and gentlemen. Stop neglecting it. I promise, if you get your sleep, a lot of people ask me, how are you always so energetic? And
I see you on your videos. I'm like, she has the most energy. Like, I need her energy. Like, she needs to give me whatever. But you're doing your thing.
The only thing I do is I can't say I get my sleep.
Mhm.
I have my me time. I have an amazing husband who's supportive. I have a 15-year-old son. He's a teenager now, so
Yes.
to himself a lot of times. But we're a team. My husband, we work together on a lot of things. So I'm not overwhelmed with stress and things like that. So and it's okay, ladies and gentlemen, to delegate. We have like this strong like syndrome where you want to do everything. You don't want to ask for help. That's just putting more pressure on you.
And it's tiring when you do that. And I had to learn to let go some things because, and it was like, okay, Misha, you have a control problem. That's because you feel like you need to control everything. And it's like now I tell my husband, we talk about it like, hey, Monday, Wednesday, and Friday, so my late day. So dinner, you have to start it, I'll finish it, or whatever the case may be. But it goes back to what you just said. You have to ask for help and delegate people to say, hey, I need you to pick up so-and-so from school for me this day. And it helps.
It's okay. Don't feel guilty. You feel guilty. You feel like you don't want to. And even if you don't have a significant other, you have close friends. You have close family that you can, reach out to. You just don't. But I get my energy because I can't do caffeine because it causes like palpitations and increased anxiety. I just be really wired. Sleep and eating. Those are the two main things that you really need to fuel your body. That you need that energy.
So so it's all on you as the individual. You said go back to getting your sleep first, and then making sure you're putting the proper meals in your body. Your water intake.
Yes, so let's go to that really quick.
Okay.
So the reason why water is good for the body, because it helps with constipation. It actually helps increase vaginal lubrication as well. Yes, it does, ladies. It also helps with your skin. It keeps your skin clear. Because what happens is when you are drinking a lot of juices and sodas, remember, you are what you eat. So when you're drinking a lot of juices and sodas, not only are you adding excess sugars in the body, but it's increasing your calories. And then too much sugar is not good for the skin.
Exactly.
Good. The more water you drink, you'll see your skin gets clearer. And you can do the water test by, if you're drinking enough water, by your urine, right? So if your urine is real dark, has like that strong urine odor, then you're not, unless you're taking vitamins, then you're not getting enough water. But if your urine is nice, clear with the tinge of yellow, you don't have that strong urine odor, then you're doing a good job with getting your water intake. And as far as the water intake, you're supposed to get half your body weight in ounces of water a day. All right, so calculate your weight, divide that by 2, and that's how many ounces you should be getting. If that's too much for you to start off with, then I always tell folks you want to start off with at least, 4 bottles of the 16.9, the regular water.
Yes.
I'll start off with 4 of those a day, but then you work your way up. So that's important. Yeah.
Wow. Thank you for that information. And then it goes back to another video. See, I don't want you thinking I'm stalking on your
no, this is
I just love it because you give so much good information and it's fun how you do it. When you said you are what you eat, and you did a video on the ladies, what you eat is like what comes, your vagina area. I was like, oh my. So you telling me my vagina area is junk because I eat junk? That's what I was saying to myself. I was like, so she telling me that my vagina area is junk because I eat junk food.
What happens is some foods, not all, but some.
I know.
Some of the foods, they transmit through our secretions. I mean, sometimes even your sweat. Like when people sweat, they're like, "Oh, I smell like I've been eating something," But it actually goes for men and women. When it comes to a man's semen, some women like to swallow. Some women just like to taste it. Some people just like it over their face, over their body. It's whatever you like. But it's important to communicate with your partner to see what you guys like to, have fun with.
Can I ask a question real quick?
Sure.
Okay. So the part where you said swallow, because this is an adult conversation and this is an adult podcast. I'm just asking, and I'm pretty sure whoever's listening wants to know the same thing too. Okay, by you swallowing, is that like healthy? Is it okay to do? Since we're talking about it.
Well, it's nothing wrong with it.
Okay.
It won't damage the body or anything like that. As far as benefits, I don't know about any internal benefits. There haven't been much research on that. But, there's this myth going around that if you put it on your skin, it's supposed to help the protein in it. But again, there's not much, research to back that or anything. So,
yes.
Hey, just like, if it works, it works.
It works. If it works for you, it's okay. But it's just one of the questions that I have, people talk, you have a conversation with people. And that's one of the things, you'd be embarrassed to ask the doctor at the doctor's office or whatever the case is, because you'd be like, okay, I don't want her to know that, but okay, it is what it is. So I just wanted to ask the question.
That's a good question. Good
okay.
question.
Okay.
So that goes back to the, if you do decide to taste it or swallow it, the semen and the vaginal secretions have a strong taste. Can have a strong taste. So some people say, oh, I don't know if you've, had the conversation where men or women have said, oh, your secretions are, you taste good, or you taste, there is actually a difference. So,
okay.
Like a lot of fruits, your pineapples, your grapes, that actually, will help sweeten like the semen and then the vaginal secretions. But when you're eating a lot of things that's kind of, like vegetables, which is good. I still want you to do it, but it can something when your diet is totally like vegetables, sometimes it cause the vaginal secretions just to taste different. It's not a bad taste or anything, but it's different. And I always tell folks, you have to know what your body looks like, feels like, and then if you want to try it out, taste it as well.
Okay.
Taste your secretions, make sure that, it's tasting the same every month, make sure it's not different, even when it comes to the odor. Make sure you stick your finger in your.
That's very important though. You would think like you want to, because I don't know, just me personally, not putting myself out there, but I'm just saying, you want to know what the change is going on within your body. So,
Yes. And you have to I have a lot of women that come in and I do their pap smears and I say, hey, has this been here? Like this lesion or mole, or has this been here? They're like, I don't know. And they're like, I never looked down there. Ew, I never looked down there. And I say, well, you really should, you should. No, because if you don't know what's going on with your body, who is going to know?
Exactly.
Rely on your partner. If you don't have a partner, then, nobody's going to know. So ladies, it's okay. Take out the men as well. Take out the mirror, take out the phone, take a picture, look, and just, examine yourself. Know what's normally down there. If you got a couple moles that's been down there, then you know that that's normal. Make sure you know yourself. Make sure you assess your discharge. Our discharge changes over time. I don't know if you guys notice that. You ladies notice that. But over time, over the weeks, our vaginal secretions discharge changes. When we to our period, we'll ovulate.
I was getting ready to say that.
So it gets a little bit more mucousy, right? And when we get a little bit closer to the periods, it becomes pastier, that the whiteness that you see on the penis when you're having sex is a little bit more pastier, but then sometimes it's like really, really wet and, not as pasty. So that's because of the hormonal changes that our body goes through. But it's important to know this and recognize this. So if you do have, like yellow or green discharge or itching or odor, whether it's fishy, musky, then you definitely want to seek help about it.
Yes, you do.
And then also when it comes to, just vaginal health, it's important to, use unscented products. If it smells good, don't use it down there,
Okay.
It changes some of our vaginal pH. A lot of people using even the Vagisil products, it has scent in it. Even the, these natural bar black soaps and
I
all,
can't. Yeah.
they have scent in it. It's natural oils that has scent. So if you're getting free, and it doesn't happen to every woman, but
yes,
you are getting frequent vaginal infections, yeast infections, bacterial infections, you need to assess what you're doing and make some changes. So nothing scented down below. That's your panty liners. That's your washing powder. That's your tampons. That's your toilet tissue that you wipe with. A lot of people don't think about that.
yes.
But you have to change to unscented, no fragrance toilet tissues. So, these are some things that you have to change. Also, if you have a diet high in sugar, that can definitely cause you to get frequent yeast. It can cause your pH to be altered as well. So yeah, you gotta.
Wow, you're giving them really good educational information and stuff, but they still need to be able to see a doctor to really explain. And it's so, like you said, it's so important for us to know the changes in our bodies, like especially women, because I only can speak from a woman point. We go through so many things through, giving birth or different things that's just going on in your life. Like when you're stressed, your body goes through the stress too, so it's very important, like Dr. Katina said, to really know your body, take examine of your body. You may feel out of shape, or you may feel like you need to lose weight, but it's still important to know what's really going on in within your body. And I always tell my husband, like, if you notice something changing within my body, like my body scent, like please tell me, because I may not catch it. So you need to tell me so we can be able to say, Paige, and if something changes with you, I will tell you. And a lot of people's like they're like, Misha, you was actually yes, I'm the one that has to,
You got it. That's important. And talk about men. Men have those changes too. Like,
yes,
they're not circumcised. Men can get yeast and bacteria underneath that skin. So it's important for them to also make sure they wash underneath, but more importantly, they dry completely, because when it's wet and moisture down underneath the skin, that's when the yeast and bacteria, that's the only way that, men can repeatedly cause a transformation or transferring of yeast or bacteria to the female vagina.
Because they're not properly taken care of.
And they have the yeast and bacteria underneath the skin. Also, men go through libido changes as well as they get older.
The men, it's not just the women, it's men too.
They go through those changes. So it's important, men, that you check your testosterone levels, because the testosterone levels can decrease when you don't have that energy. You feel down, depressed, men get stressed out as well. So it's important, ladies, to know your partner, know their characteristics, know their personality, know their attitude. So when you do see changes, help them, because sometimes men have a hard time expressing themselves. So yes, help them communicate. Just say, is there anything I can do for you, versus, bringing more attention to it or being angry because he's not doing this fast enough. Just learn how to effectively communicate. When my mental health patients come to me and they sit down, they're having relationship problems, it's just important to talk about those effective communication techniques, so that you're not making the environment more hostile, because your partner is your partner. It's supposed to be fun.
Yes.
Enjoyable, somebody, your partner, your right-hand man, your best friend, somebody you can go and talk to, but it should not be stressful, tense, argumentative,
yes,
like that.
Yes. And you spoke on about mental health, like, mental health is so important. And with all this, we've been going through within the last few years,
and I have seen an increase in the mental health aspect. And over 40, speaking of more things over 40, it can happen before, but see where the anxiety increases over 40. More women and men start to have panic attacks.
And people don't take it serious.
Yeah.
They don't. And I work with adults with developmental disability and mental health. Me and my mom, we have an agency, a successful journey. And mental health is really real.
Yeah. But I'm glad to say that a lot of Black people, whether it's Caribbean, African Americans, they are more going help now. And I like that. I like how it's trending towards that, because before, we would keep that trauma inside. We would not talk about, some of the things that's bothering us. We would be overwhelmed. And that's how the blood pressure starts to raise. Patients where their job is so stressful, when they went to work, their blood pressure was sky high, but then like, off from work and they're fine, like just say on vacation, their blood pressure is perfect. And stresses of our job can really increase our anxiety. So anxiety not only affects us mentally, but as we know, physically as well, along with depression.
Exactly. In the thyroid part, going back to the thyroid part, you will see some things, will play with your anxiety.
Oh,
like with the not mental health, but the thyroid plays a, like you said, big part of your body.
And your body is going through a change. Snappier. Yeah, you get snappier, you get short-tempered, you're not as nice as you used to be.
Yeah, so it's very important to know your body, when you're going through the changes, so you can really get some help. And if you are dating someone or you're with someone, whatever the case may be, a friend, if they noticing some changes in you, take heed into it,
Yes. Because, and don't be afraid to speak about it.
Because, exactly.
That's why I have like my teen women and men health parties from time to time. I need to get it back going on, because now that we're back open, but that I provided those parties because it's a chance for us as, just people to get together and to talk openly and transparently with the healthcare provider like myself, that they can ask the most raw questions as they want to ask,
Yes.
I always tell folks, what you're asking, trust me, somebody else want to ask that question.
And they're just ashamed to say it,
Or you're not the only one that's going through the change,
Exactly. You're not
going through that issue. Somebody else is going through the same thing. So,
and I see that you offer, is it the vitamin, the
B12?
B12.
Yeah.
B12. Can we talk about that?
Sure. So the B12 is like a natural supplements that you normally get through foods. You get it mainly through your dairy products. But as you're older, a lot of people don't eat like a lot of dairy products. So they're low on vitamin B12. When you get really physical, normally the healthcare provider would check for your vitamin D, which is important as well, and then your B12. So when the B12 is low, that can actually cause low concentration, low focus, low energy is the big one. Because B12 helps with our nervous system. So people who have low B12 also have increased anxiety as well. So if you're not getting it replaced through your foods, then, you have to take a supplement because if not, you're not going to feel right. Okay. You have energy. So some people take the B12 supplements over the counter via the mouth, through a pill. But of course, the B12 shots that I offer at my practice, and, many other people offer it as well. The B12, the shots, they get right there to the system. So it's once a week. You don't have to take it every day. It's just one injection. Now you have different types of B12. You have the cyclobenzapine, that's like the made up one or one compounded, and then you have the methylcobamol, and I could say that wrong, but it's the one with the methyl. That's the B12 that's more from the food, so that's the natural form. Methyl. So I always bring that up so patients know that there's a difference between the different types of B12.
Yeah, I didn't know that.
I want you to, when you're looking for your B12, get the methyl, the one that starts with the methylcobalamin. Get that one because it actually, it's more of the natural
form. Okay.
Yeah, it mimics the ones that you would get actually from your food intake. So that's the injection that I provide. And it makes you feel great, gives you that natural energy because some people can't do caffeine. Some people can't do these energy drinks because over time, it increases the blood pressure, it increases your anxiety, it increases the heart rate. It's just, over time it can take a toll on the body. So,
Wow.
you want to get it through your foods, your supplements. You want to get it through your sleep, naturally.
Wow, that's awesome. And wow, you have covered a lot of things. You have covered so much to me. I know. And I was just talking to my mom about this other day because I had a doctor's appointment. Mm-hmm. And I was like, she didn't even ask me if I had any concerns or questions. And like, she didn't educate me on it. And she was like, well, you should ask. And I was like, but no, she's the doctor. So we're going back and forth. Uh-huh. And you have given me so much information. And it's like you're a one-stop office. Like I could go there and get my pap smear. I can get primary care, taking care of wellness and fitness. Like
I am what they call multi-specialty. And
I love it
because I have been practicing for so long, and I've practiced in different settings. So I practiced in the urgent care, the primary care, gynecology. So some patients, they come to see me just for gynecology. They have their primary. Some to see me for primary. Some people come and see me for mental health. Some people come see me for everything. You can't cover everything in one visit.
Yes.
So I always encourage patients to write down their questions. Mm-hmm. We have to do foundational work first. So we always have to do the blood work first because we have to know what's going on the inside. And then you make a follow-up appointment to discuss further concerns that you may have. And then, you go from there. So always telling you and, listeners out there, write down your questions. And then it's okay to follow up. You're not going to, go through everything in one visit.
Yeah.
Fortunately, on our end, we don't have the time for it because we have to see like other patients.
Yes.
But that's why I love having my own practice, because I actually get to sit down with my patients in the time frame that I want to versus normally you just have like 15 minutes to see a patient. So if you see that a provider is rushing you, it's because they don't have the time. But in my own practice, I give each patient 30 minutes. That way I get to sit down with them, talk with them.
She didn't even give me 30 minutes. She gave me 10 minutes.
Now that's short.
Yes.
Short to you. At least it's supposed to be at least 15 minutes.
I was like 10 minutes.
But then that's when you go back and you make the follow-up appointment to go over some more things. So
Yes. So I want you to give the listeners, anybody that's looking for a local doctor, if you're taking in new patients at the moment, your information.
Where are you located?
Hollywood, Florida.
Oh, you're in Florida. Okay. Because I do, podcasts all over. So I wasn't sure Eastern Standard Time because sure, where you were. Oh, you're right.
No.
Yeah, so I'm right here in Margate, Florida. My website is Dr. Katina healthandwellness.com. My link tree is like in my Instagram bio. So if you click that, it'll take you to like my professional website where my masterclass about my vaginal orgasm class that I had.
That's what I wanted to.
Vaginal orgasms. We still got time.
Yeah, that's what I wanted to talk about.
So that's my website. It'll take you to my office website if you wanted to make an appointment. It'll tell you my times, the different insurances I take. And then I have my mental health part of my website that'll take you to there as well. But yeah, so you want to speak about the orgasm?
Yes, I saw the video. See, I watch your stuff. And I was like, okay.
So what we did though, we did a masterclass where we actually me and the sexualist, Miss Sherry Shabazz. We did a recording.
I know Sherry Shabazz. Yes, she's awesome.
Yeah. So we're supposed to be having something coming up in June as well.
Okay.
We did a master class where we would talk about just the different types of orgasms, because you have your anal orgasm, your cervical orgasms, you have your G-spot, you have your nipple orgasms. We talked about the importance of knowing your erogenous zones. So the recording that's on my actual website that actually is that program in case you missed the actual, Zoom.
Okay.
So people can go in there and purchase it. But you have to, know your body. You have to explore your body. You can't expect a man to make you, or a female, your partner, to make you have orgasm if you really don't know how to elicit it yourself. So I always tell people, you got to explore yourself, because you have to know what an orgasm feels like before, you go for it. Also, most women can have an orgasm. It just goes back to that mental. You have to be relaxed. You can't be stressed. You can't be tense. You have to let it flow. Explore your body yourself. When you're riding on top, you should, what feels good. So you should stimulate that spot to make you have that orgasm. That's why a lot of women like to ride, because, they know what spot to, continuously tickle that'll make them have that great orgasm. And orgasms and sex is actually good for the heart. It's good for the mood.
Yes.
It's on the serotonin on the brain. So
it's good for everything. Joking.
No, it is. It is. If you
it's good for headaches. It's good for
it causes vasodilation. It opens up. So if you notice, just think about it, Misha. If you notice that coworker, if you ever dealt with a coworker, she's mean, she always coming in nasty, and then one day she come in, hey y'all.
You know what?
She must be got her some. She must be got her some. She feeling good.
You know it.
Then that's why. So I mean, it really does affect us.
Yeah. So sex. What do you say? Milk makes the body good, right?
Yeah. Sex does a body good.
Okay, well, I can't wait to your thing come out, and you said June, so I'll be looking forward to it.
We'll put the flyers. It's actually going to be in person, so that's going to be some live sex position demonstrations going on, and it's going to be fun.
I'm looking forward to it, because that's interesting.
Yes.
Well, I want to thank you for coming on to the Change After 40 podcast, and I will be putting all your information in the description box.
Thank you. Thank you.
And I really appreciate you coming. It was very informational, and I hope anybody that's listening really took heed of a lot of information that Dr. Katina gave, and just good information. She didn't just give information; she gave great information. And
you got it. And before you end, I just wanted to just say, if you did want to purchase my personal lubrication, you can go to sextivia.com. SXTIVIA. It doesn't matter if you get wet already. What it does is it enhances it. It's so
do it makes you feel like
prolonged if you're going for because if you're going for a prolonged period of time, like if you're going for more than 30 minutes, sometimes women, especially if you're using condoms, may dry out a little bit. So it just keeps it going. It keeps it going. If you want to purchase my book, you can go to my website as well, drkatinakennedy.com. That's the professional website. And that's the one that's Let's Talk Sex and STDs, the student edition for those who have preteens, because you don't want your child to get to middle school and not know what their anatomy is.
Exactly. You don't want someone else teaching your kid.
Because in middle school, believe it, that's when oral sex is very prevalent. They do oral sex and anal sex. They don't even do vaginal. They do oral and anal in middle school in the stairway. When I created my book, a lot of teachers was, I researched and, interviewed a lot of educators who work in the school system, security guards. They always catching them in the bathroom.
Wow.
Get my book. So my lube, my book, I have a foundation in which I give scholarships yearly to deserving high school seniors, or I give like care packages, supply packages. If you want to donate, it's all about Healthy Living Foundation. You can donate, and then that way we can, because it's not about me. It's about, helping others. It's about others. And just remember, you get your blessings from what you do for others.
Amen.
You bring in that positive energy, you put out positive energy, you get positive energy back. And then one last thing, remember, you cannot take care of your purpose and passion in life without taking care of yourself first. Always remember that. You cannot take care of you cannot carry out your purpose and passion in life without taking care of you. So make the change. As a reminder. Thank you, Misha, for having this podcast. That way you can educate women, men who are listening.
Yes.
You never know who you will impact. So thank you for doing what you're doing.
And thank you for impacting on the other end, because you guys have to go check her
Instagram.
TikTok out, Instagram.
Yeah, Instagram. I just got on TikTok, y'all. So y'all gotta follow me. It's at Dr. Katina _.
And your little workout thing when you be, I say, look at her, she is doing it.
I love to dance. I love educating. I'm a professor as well, so I teach by nature and by profession. So it's like I love to be creative. So the TikTok videos are pretty fun. I'm just getting on. I'm late to the party here,
but you're doing good. You're doing good. You got that little black girl magic sprinkling all over everywhere.
Right. I love it. I love it.
Thank you, and enjoy the rest of your day. And love you. Thank you.
All right.
Mwah. Talk to you later.
Care.
Okay. Bye-bye.
Bye.